Hey guys, this is Dr. Hub. Today we look at the polycythemia. Polycythemia, there is a Vera criteria. Polycythemia Vera criteria, and this will be the WHO as per the WHO. So looking at the major criteria, the major criteria is basically the hemoglobin greater than 16.5 mg per dl. This is in terms of men. Then comes in terms of women, what is it? In women, it is greater than 16.8 gram per dl. This is in terms of the women. Or let's look at hematocrit. The hematocrit is greater than 49 in terms of men and greater than 48 in terms of women. Then as we look at the bone marrow biopsy. So the bone marrow biopsy, it shows the hypercellularity, and this is with the trilineage hyperplasia. This is with the trilineage hyperplasia, and that is, it includes the panmyelinosis and also the prominent erythroid and the prominent erythroid. Next, it also includes the granulocytic, then the megakaryocytic proliferation, and this is with the pleomorphic mature megakaryocytes. Pleomorphic mature megakaryocytes, and this is present in the bone marrow. Then comes the presence of JAK. So this presence of the JAK2 exon. This is 12 mutation. Then let's look at the minor criteria. The minor criterion, it includes a subnormal serum erythropoietin. So there is a subnormal serum erythropoietin level, and the diagnosis of polycythemia vera, it requires meeting either all three major criteria. So there should be all three major criterion should be positive, and or the first two major criteria along with the minor criterion should be present.